Hi, this is Giselle Rivera again, and I will be introducing the pelvic girdle, which is the bottom portion of the body. I will begin with the coxal, I will begin pointing out the approximate borders of the three bones that fuse during development. That would be the ilium, the ischium, and the pubis all together. Here, I will be also pointing out the acetabulum, which is where the head of the femur connects to. So this little hole here is the acetabulum. The pubic symphysis, which is the middle of where both girdles connect here in the middle. And then the orvituator foramen, which is this hole here. The iliac crest, which is the top portion of the pelvic. And then we also have the anterior superior iliac spine. And then that would be this portion. It's like a little wing that kind of faces out. It has like a 3D. And then we have the iliac fossa, which is this here, the inside portion of this. And then we have the greater sciatic notch, which is down here on this side here. That's the greater sciatic notch. And then we also have the ischial spine, which is this little thing that sticks out here. If you can probably see it through the back. That's the ischial spine. And then we have the ischial tuberosity, which is this here. Going to the femur, we are done with the pelvic girdle here. So we're going to be using the femur, and then on the femur, I will be going over some of the parts here. And so one of them is the head, which is the very top of the femur. And then we have the greater trochanter, which is this. And then we have the lesser trochanter. And then we have the adductor tubercle. And the adductor tubercle is right at the bottom here, and that would be here. Then we have the medial epicondyle, and then we have the lateral epicondyle, and then we have the medial and lateral condyles, and those are the ones in the middle. This one's covered by the patella, but it's like right here in the middle kinda. And then the patella, which is this cute little bone sticking out on the femur, that's the patella. Moving to the tibia, which is the bottom part of the leg. So the inner bone is called the tibia and the outer is called the fibula. Moving to the tibia, we have the medial and lateral condyles. So, oh my God, I'm sorry, I'm running out of breath here. So the medial and lateral condyles, so the middle and then lateral condyles. And then we also have the tibial tuberosity, which is probably this right here. And then we have the medial malleolus. The medial malleolus is this little bone sticking out kind of towards the calcanea bone, the bone on the foot. And then we also have the proximal and distal tibiofibular joints, and those are up at the top. For the fibula, which is the outer, we have the tip of the fibula, or the head, and we also have the lateral malleolus, which is the end of the fibula, this corner here on the outer part of the foot. Moving on to the foot, what we call the tarsus in the medical field, we have the talus, which is the bigger bone on the foot. This is where most people with plantar fasciitis feel the pain of that muscle pulling strength on the foot when you do this motion, the dorsiflexion on your foot. Here you're asking, what bone does it articulate with? It articulates with the metatarsus, and the metatarsus articulates with the proximal phalanges of the toes. Then we have the talus, so we're gonna go over some of the bones here. And so the main one that I just talked about is the calcaneus, and then followed by the talus, which is here. And then we go into the navicular, And then we have the cuboid. And then we have the medial, intermediate, and lateral. So we have medial I'm trying to say that right. Medial cuneiform and intermediate, and then lateral on the side. And then we have the metatarsals, and then we have the phalanges. And then you're asking for the hallux, and I believe the hallux is the bone, which is like the toe bone right here in the middle. And that's the one that gives people like the calluses when it outgrows, like when it just gets distorted onto the side. That has been my presentation for the appendicular system. I hope I did well, and I will continue to see you in class. Thank you, Professor.